Now, overuse of one of our most common medicines is killing thousands of people in the country every year. That's the warning from doctors as a new campaign is launched about antibiotics. And more of them are prescribed here in the northwest than anywhere else. It's claimed around 5,000 people die each year in England because antibiotics no longer work for some infections. Well, earlier I talked to Dr. Rob Barnett, who represents Liverpool GPs, and I asked him what are the dangers of taking them when you don't need them.
If we use antibiotics for coughs and colds, which are basically viral infections, when they're not needed, we're going to end up with resistance to antibiotics. And as you've already reported, we're seeing more and more strains of infection, bacteria that don't respond to antibiotics, and that's going to cause us problems in the years to come.
So, is it too much to say that it is killing people, this resistance to antibiotics?
Well, the reports seem to suggest that we're now seeing something in the region of about 5,000 deaths a year from antibiotic resistance. And what we really need to do is try and make sure that people only take antibiotics when it's appropriate. And if they are prescribed, to actually take the courses for the length of time they're prescribed, in the doses they're prescribed. We're seeing too many patients who perhaps take antibiotics for only 2 or 3 days. They feel better, stop taking the antibiotics, and that's when the bacteria will end up developing a resistance to antibiotics. So when they're actually needed, they won't work.
This new campaign is saying, you know, don't use them when you shouldn't use them, but presumably they are being prescribed antibiotics. So do some doctors need educating about when to prescribe them as well?
I think it's partly about reminding doctors when they shouldn't prescribe antibiotics, but also it's about people's expectation. A lot of people come to see their doctor expecting antibiotics and get quite upset if they're not prescribed, and actually think they're being done out of medication that would do them some good. And it's about, really, the campaign is to remind people that for simple viruses, for coughs, colds, flu-like symptoms, antibiotics have no part to play. They just do not work.
Dr. Rob Barnett speaking to me earlier. Now, an announcement is expected.